Hi, everybody. This is Dr. K from Holistic Minds. I'm so proud to be introducing Dr. Darin Ingels to you. He is a brilliant physician, an expert speaker traveling the world. Every time I talk to him, it seems like he's somewhere else doing a lecture for a group of physicians or a group of parents. He has been treating God knows how many people and children with pandas and Lyme and chronic infections, and he is just a wealth of knowledge, and I'm so happy and proud to have him here to be sharing his wisdom with us and with you. So thank you for being here.
Thanks for having me, Benjamin. I'm really excited to be here.
Well, yeah, you've had quite the journey. So it's interesting because sometimes our path is what kind of takes us to where we need to be, right? So for me, like starting the Holistic Minds and doing all of this, I was the child that had my own host of kind of neurosensory behavioral challenges. And it seems like once you finished Bastyr medical college, naturopathic medical college, and you were starting your career, you were given a gift of some sort, if you want to call it that.
The gift that keeps on giving. Yeah, I was living in Connecticut, and I had only been there for maybe a year and a half, and I was getting ready to open my own practice, and I got bit by a tick, and I got Lyme disease. It's one of those things, I think when you live in certain parts of the world, you kind of expect, if you live in Arizona, getting valley fever is pretty common. If you live in Connecticut, getting Lyme is, again, pretty common. So, I had classic Lyme disease. I figured, okay, I know what to do about this. And I got treatment right away. And really after 4 or 5 days of being in treatment, I felt really perfectly fine. But it was really the perfect storm that, I had just, as I opened my practice, I was doing everything. So I was working very long days, wasn't really taking care of myself the way I should have. And after about 8 months of keeping up with that schedule, I started to relapse and started getting symptoms again. And, at the time I didn't really panic. I'm like, okay, I know this can happen and no problem. I went on treatment before, I'll do it again and then I'll be fine. And I went back on the same treatment I did and it did nothing. And then I changed treatments and it did nothing. And I really went through about 9 months of changing, treatments, and it just wasn't getting any better. And all these treatments were really antibiotics. So as I kind of got worse and worse going down the line, it was kind of my wake-up call that, I need to find a different path. And so I had known about a doctor in New York City, a Chinese medical doctor who had been using herbs and acupuncture to treat Lyme patients. And I saw him, and I had seen some patients over the years that had worked with him. And I started his protocol. In about 3 to 4 weeks, I noticed I was significantly better.
Wow.
So, again, that was my slap in the face. It's like, hey, you got to go back to your naturopathic roots and really examine, how are you living your life? Are you really doing all the things you need to do to get well? And once I really started implementing that, plus the protocols he had instituted for me, it still took a while to feel like I got my health back. But, after a couple of years of being, on the ball, so to speak, I really felt quite well, and all the symptoms I'd been dealing with were gone. So, it was, as you said, this gift that I was given that at least gave me the perspective of what it's like to deal with, something like Lyme and a chronic illness. And, of course, you learn a lot through the process. So certainly it made me a better person, made me a better doctor. And of course, now I can, sit down with patients who've been dealing with Lyme disease, and I know what it's like to walk in their shoes. And I've experienced pretty much everything that most people with Lyme deal with. So in whatever weird way that manifests, it does help you appreciate what people go through with any kind of chronic illness. But there's also hope at the end of that tunnel that, people can get better.
Good. Well, do you think if you had not gotten, well, you probably would have gotten bit by some tick, but had you not ended up with chronic Lyme, that you'd be here?
No. I mean, I'm sure my path would have gone down a very different direction. So again, in whatever way the universe manifested, that was my path. That was my thing that I had to go through to be able to do what I do now. And again, I'm quite sure had I not experienced that, my practice would be very different. My life would be very different. So, I'm one of these people that kind of believes everything happens for a reason. And although we can't always see it at the thick of things, and certainly when bad things happen, we don't appreciate it at all. But again, it has given me a perspective that I wouldn't otherwise have had I not been through that process.
This journey of yours hasn't produced a slouch. You've written multiple books. I see your Lyme solution book in the background. You're actually launching a course online. And in a way, you're on a mission to help as many people as you can learn about Lyme and ultimately get better from Lyme. Because there's so many people that are suffering, right? This isn't just one or two people here and there.
No, I mean, if you look at the U.S. statistics, I mean, it's 300,000 new cases a year, and that's probably an underestimate. So we don't know what that true number is. My guess it's probably 500,000 people or more, and that's every year. So, you can do the math and figure out that we're really now talking about millions of people worldwide living with Lyme disease. It's been reported in all 50 states in the U.S. It's been reported on every continent except Antarctica. So it's everywhere in the world, and it's a growing epidemic, and we're just going to continue to see more and more cases. So it's just one of those unfortunate things that, there's a lot of political controversy in and around Lyme, which is a shame. And I kind of see it, it's kind of like what HIV was in the early 80s, where if we ignore it, maybe it'll just go away. But clearly this is not going away, and we've got this epidemic we have to learn how to deal with.
Yeah, and Lyme is really difficult to treat. I mean, I've been humbled to realize how much I don't know, and that's why I'm so grateful to have you here, because I know about Lyme, I'm aware of Lyme, but I certainly wouldn't consider myself an expert by any means.
Well, you're a step ahead of most doctors then.
Thank you. You're
in
really
California. It's funny, having been in Connecticut for 18 years and now being a full-time California doctor, I've been surprised at how many physicians and healthcare providers here are really quite unaware about Lyme, and they're not looking for it. And yet even the CDC says that California is the 5th fastest growing state for Lyme. So again, it's here, it's growing, and I hope that more practitioners will really start to become aware of it and start testing people.
Yeah. I mean, to be honest with you, as of a few years ago, I didn't even know that Lyme existed in California. So we had some families that would be traveling to the East Coast, and they're like, "Yeah, I got bit. We got this rash." That would be a no-brainer because any physician knows to look for that. But I think the problem is that the more subtle cases and the things that you don't know to look for, like if I had rewound myself back 5 years ago, I wouldn't know to look for Lyme if someone was in California. Right. And that's why I'm really happy to have your wisdom and your expertise here, because this is what I want people to hear about. Right. These cases that we don't expect, because at the end of the day, it's what we don't know, or the cases that we don't expect to look for that are causing problems, that create scenarios where, we have the impossible healing, but it's not impossible. We just don't know what to look for.
Right. Well, I mean, I think a great example, just to kind of, frame it, I had a patient come in who lives here in Orange County, California, whose mom has Lyme disease. He was 8 years old, and he developed a very high fever and joint pain and headaches and neuropathy, a lot of very classic symptoms for Lyme disease. And he was admitted to the Children's Hospital of Orange County, and the head of infectious diseases refused to even test him for Lyme and says, "We don't have Lyme in California."
That's
and
crazy.
The mom has classic Lyme. She's CDC positive. And they refused to even test him. I couldn't wrap my mind around that. I'm like, he's got every sign and symptom. Mom has a history, so clearly, wherever they are, they've got a possibility of exposure, and they just wouldn't test him. And unfortunately, while he was in the hospital, he really didn't get much treatment. He was discharged, and when I saw him, we tested him, and he was CDC positive. So, I don't know what to say when practitioners are being kind of bullheaded like that and just refusing to even bother testing people. They wouldn't even do the standard test. So we've got a little bit of a mountain to overcome with, just getting healthcare providers on board and recognizing that it does exist, it is a problem, and, at least rule it out for people who've got symptoms. I think education and, getting that information is the first step, for people getting better. Because we know with Lyme, the longer it sits there and doesn't get treated, the greater potential it has to become chronic, and that just creates a whole host of other problems.
Well, let's dive into it if you don't mind, because we obviously our focus in our community is really around children who have severe behavioral problems.
Right.
How can you help our families understand how Lyme and I guess the host of co-infections ultimately derail the immune system, I guess we should say, which then derails the nervous system? Or how do you contextualize it? How do you help families see how a Lyme infection, especially a chronic Lyme infection, can ultimately cause a child to go berserk?
Yeah. Well, it's one thing, if your child comes home and they develop a very high fever and they're acutely sick, it's very clear as a parent that they're ill. You take them to the doctor, the hospital, you get them tested, you get them care. I think what's less known is that, a lot of these microbes, not just Lyme, but we know Lyme and strep and Candida, Mycoplasma, a lot of these organisms have the capacity really to trigger an autoimmune reaction. And much like, the typical PANS thing we think of with strep, it can really happen with any other microbe. So this capacity to trigger an autoimmune reaction that starts cross-reacting with the brain in particular, we'll see various neuropsychiatric symptoms. And when you see this child who is developing normally, behaving normally, and then really within a matter of days, that switch flips and they start becoming a completely different person, for me, that's a really big red flag that, that's something we really need to investigate. Have they had some sort of exposure to a microbe? And although they may not have gotten the classic symptoms of infection, it may have stimulated this autoimmune reaction that's triggering that PANS-like behavior. So, fortunately, through blood tests and stool tests and organic acid tests, we've got various tests we can utilize to try and help pinpoint, which organism might be the biggest factor. Testing isn't perfect, and Sue Suedo, who's the person at the NIH who really kind of coined the term PANS, came to speak to a group I was at last year and kind of said, look, testing's not very helpful, which we were all very disappointed to hear. I think there's still value, and that in some cases it can really help hone in on what that trigger might be. For Lyme, in children, we expect that we're going to see classic Lyme symptoms. And in many kids I work with, that's not the case. We don't get the bullseye rash, we don't get the high fever, we don't get the joint pain. We'll get, behavior problems and mood changes and sleep disturbances and bowel changes. So, when I start to see these chronic symptoms that are really persistent and getting worse, and they've had a lot of testing done and everything kind of keeps coming up negative, it just makes me wonder if, there's some sort of microbial exposure that, might be that underlying cause. And it's kind of interesting because when you go into the medical literature, we've actually got a lot of evidence of these microbes becoming autoimmune triggers. So this isn't really anything new or fringe. It's just something I don't think is terribly recognized in the medical community. But certainly my experience has been for a lot of kids, with these PANS and behavior issues, the overwhelming majority of time we can pinpoint it to a specific microbe that's triggering that set of symptoms. And once we know what it is, we can start implementing treatment to get it under control.
Well, can you help us first understand the kind of neuropsychiatric manifestations of these infections? I mean, you've seen a lot of these kids. How do they generally present? What's the kind of the presentation or look of these kids?
So, you can get a lot of the very typical PANS things where, it's anxiety, it's OCD behavior, it's tics, whether it's vocal tics, motor tics, it can be any variation of that. But I've also seen a lot of other, neuropsychiatric symptoms. Again, mood changes is one of the biggest things. When you've got a kid who's generally happy and all of a sudden they're grumpy and irritable, and that's not them, again, for me, that's a big red flag. I often see kids who now all of a sudden don't sleep well. These were kids who were always great sleepers, and now they're waking up in the night, they're having difficulty falling asleep, they complain of nightmares. Some parents will tell me they start sleep talking, sleepwalking. Again, things that are sort of very atypical for their sleep pattern. We also hear about kids start, really doing poorly in school. They were getting good grades, getting their homework done. Now they're not completing assignments. They're slower in class, getting things done. They're answering incorrectly. And, the nature of all these things is when it kind of comes on in a pretty short time period. When I start to hear about these changes that happen over days to weeks, again, there's very few things I think that really can trigger that. But certainly, cognitive function, memory, that can be a big part of what happens as part of this neural inflammation. So, of course, the brain's horribly complex, and depending on what part of the brain gets affected, really kind of dictates how that symptom picture is going to manifest. But, again, any kind of neurological thing. I've seen kids who even start having coordination problems, balance issues. These were kids who were very athletic and were able to, climb the jungle gym and do activities. And now the parents notice that they're clumsy, they're falling over, they're dropping things. Again, for me, that, sends up a red flag that there might be some sort of neural inflammation, and we just need to sort out what it is.
The brain, in a very simplistic way, just malfunctions depending on what part of the brain is hit.
Exactly. Whether it's, the frontal lobe, temporal lobes, occipital lobe, I mean, each part of the brain obviously holds a different function. And, why one part of the brain gets affected more than another, I don't know that I have any great answers about that. It's kind of interesting when you look at Lyme specifically, we've got some pretty good research that there are very specific proteins that get targeted in our neural tissue. And that, as the body's trying to fight Lyme, it's accidentally attacking our own brain and nervous system. And that's why we start getting all these issues. So, it's just one of those complex things that I'm not sure we really understand the depth to which it impacts, the brain. Outside of knowing that it does have an impact, I think when you start getting down to those, mechanisms of what's really going on, it's a little bit harder to understand. And obviously we don't do brain biopsies on living people. So, we just don't really have the capacity to measure what's going on with the complexity of, the neurotransmitters and the hormones and all these things that regulate neurological function. But I think, the take-home message for parents is that, when your child's acting one way, and in a short period of time, you start seeing a really different child, in front of you, that should, lead you to think that there may be some sort of microbial trigger. And then, that's just working with your healthcare provider to try and figure out what it is.
Got it. Well, thank you for that. If you were to prioritize, so we've got Lyme, we've got Bartonella, we've got various other co-infections, how would you kind of help navigate someone? So if someone's going to their primary care doctor and say, look, my kid was normal, suddenly they're flipping out, we may or may not have had some kind of signs of Lyme, they may have had an infection or whatever else. How would they navigate the waters in terms of testing and what things you can test for? Are there certain infections that we really can't test for? I know like some of the lab testing that you can do through LabCorp and Quest sometimes reveal it, sometimes don't. So how do we navigate these waters?
Yeah, well, gosh, every time I go to a conference on, certainly tick-borne illness, it seems like the list of things that can get transmitted through a tick bite gets longer and longer. And again, many of these things we can test for, and a lot of things we just don't have good commercial testing for. So I think, do what you can. I do recommend using a good Lyme lab if you suspect a tick-borne illness. Unfortunately, Quest and LabCorp and a lot of your big reference labs, the test kit they use just isn't very sensitive, which means it doesn't pick up a lot of people who actually do have the illness. So fortunately, we do have a lot of better labs out there. So I think as you're working with your healthcare provider, make sure that, if you're going to go through the process and get them tested, and most of this really is done through blood testing. So, there are some simple blood tests, run through a good lab that certainly increase the likelihood of picking up Lyme if it does exist. Unfortunately, these labs also test for the variety of co-infections. So from a single blood draw, you can really test for, Lyme and Bartonella and Babesia and Mycoplasma and, really kind of as many things as you feel like you need to test for. Beyond that, I think there's some value in doing stool testing. Sometimes we find that there are microbes that are in the gut that can also become a trigger, so it's not always tick-borne. I mean, off the top of my head, I think Klebsiella is one of these, organisms in the gut that tends to be a major trigger for autoimmunity. Viruses can certainly do that, Epstein-Barr virus, herpes 6, and so forth. And even some fungi, things like Candida can be triggers as well, in which case organic acid testing sometimes can be very valuable, which is a urine test. And it can see if you have any kind of metabolites of yeast or bacteria in the urine. So, it really is about kind of, covering the gamut of all the different things. And as a parent, it may sound very overwhelming to kind of walk into your doctor and say, hey, I need you to run all these tests. So, there may want to be some sort of a methodical way of doing it. But I think, starting with the blood tests first, because those are the more likely culprits of things that tend to trigger these behavior issues. And if everything there seems like it's negative, then you might want to go down the line of doing stool or urine testing to look at other types of microbes. But certainly getting good blood testing through a lab that specializes in tick-borne disease is a really great place to start.
If someone doesn't have the funds, or let's say they're somewhere where they can't get access to a doc that's willing to order these more specialized tests,
yeah,
what percentage of the time would you say the reference labs like Quest and LabCorp can find it? So I guess another way to put this is, obviously, if it's positive, then it's helpful.
Right.
How often do these, more simple insurance covered tests cover it before someone has to jump into the more sophisticated ones? And I know obviously the more sophisticated ones, if you could afford it, you want to do it right off the bat. But in these other cases where people may be limited for whatever reason.
Well, out of all the things we're testing for, I mean, there are things you can run through a regular conventional lab that your insurance is going to pay for. If you're testing for strep, if you're testing for mycoplasma, things like that, I think, using any lab is fine. There's not a lot of variation in the test kits. The one wild card there really is Lyme. Lyme is one that the conventional test kit that's used has a sensitivity that's under 50%.
Wow.
Depending on who you read, it could be anywhere from 35 to 47%. So that means, again, if you have the disease, the likelihood of picking it up is less than 50%. That's not a great test. So the Lyme is the one where I'm pretty adamant that if you're going to do it, you're better off doing it specifically through a lab that specializes in that. But for a lot of the other co-infections, again, those you can run through your reference lab, and I think their testing is fine. I work with one specific lab in New Jersey called Medical Diagnostic Lab, and I like them because they do bill your insurance.
Oh.
So you get the benefits of insurance billing. I think they do better quality testing. It's just a function that, you have to draw the blood in the office and then send it to New Jersey. But if doctors don't mind doing that, you can get a better lab test and it gets billed to insurance. And for people who don't have any insurance at all, their cash pricing is actually very reasonable and affordable. So I've had several patients over the years that don't have insurance, and if you run Lyme and pretty much all the co-infections, which is all antibody testing, I think the cost is somewhere between $200 and $250.
That's not bad.
Is reasonable for the amount of information that you get from it.
And how accurate would you say this company is, or this laboratory is?
Well, accuracy is a little bit hard to measure because the CDC guidelines on what they call the test positive is very strict and really hasn't changed in 40 plus years of research. Wow. So, a lot of us in the Lyme world are looking at these tests and interpreting it in a way that's different than what the CDC is interpreting. So, the test may say negative when you get it, but what I like about this lab in New Jersey is that they actually send me a copy of this test. This test is called a Western blot, and it's basically testing for several different antibodies. And it's like a strip, and there's a bunch of little lines on it. So what most labs do is they run the test and they just give you their interpretation, where this lab actually gives you the raw data and you can look at it yourself as a practitioner and then kind of come to your own conclusions on it. So I like the fact, again, I used to be a microbiologist before I was a doctor. I used to do these tests for a living, so I know what I'm looking at. And I find it very helpful to be able to look at these strips and be able to come up and with ideas about whether someone's really had exposure. And with Lyme, I think it's important that people understand that this is a clinical diagnosis. And what that means, it's based on your clinical symptoms. It's not based on a lab test. If you go to the CDC's website and you read about Lyme disease, it says right there on the landing page for Lyme that it's based on your signs and symptoms and history of exposure, particularly if you live in an area that's known to have a lot of ticks. So the piece of paper is really just confirming your suspicion. We like to have positive tests because as practitioners, of course, it makes us feel confident that we're instituting a treatment that's appropriate. But I've had patients over the years where their tests come back negative. They have all the clinical symptoms. We treat them empirically and they get better. So, don't hang your hat if the test, if the test is negative that there's no Lyme. That may not necessarily be the case. But, when you start seeing all these symptoms that kind of fit and you've ruled out everything else, I was taught in medical school, if it walks like a duck and quacks like a duck, it's probably Lyme. So, I think the same holds true for Lyme.
Got it. How do you go about, so obviously acute Lyme, fairly easy. You use something like Doxy for period of about at least 2 weeks. Yeah. For the more chronic cases, so let's say there's a high degree of suspicion and the family with their practitioner says, okay, this we think is Lyme, testing is plus or minus, but we want to go ahead and dive in. How would they go about treating the chronic Lyme infection?
Yeah, so with chronic Lyme, I'm much more in favor of using herbal medicine. The problem with antibiotics when you get into chronic Lyme is they just tend not to work very well for most people. And there's actually quite a bit of research on using antibiotics in chronic Lyme. And what it finds is either it doesn't help at all, or B, if it does help, it only helps while you're on treatment. And as soon as you come off the treatment, you're kind of back to square one. So in terms of, getting long-term resolution of Lyme from antibiotics, unfortunately for most people, it just doesn't work the way that we intended. The other concern I have is that, one of the things that Lyme can do to your body is it can damage your mitochondria. And, mitochondria are the part of the cell that literally create energy. And I think, a lot of our kids, particularly those on the autism spectrum or have other special needs, mitochondrial damage is not an uncommon underlying problem that already exists. So if you have a child that's got any kind of mitochondrial issue, they've been exposed to Lyme, which further damages their mitochondria. Then you add antibiotics, and many antibiotics also damage the mitochondria. Again, you've really kind of created this perfect storm that it's just going to be hard for kids to get their energy back, their muscle tone, their nerve coordination. All of that's going to be a function of how their mitochondria are functioning. And we know that you're going to undermine that process, with antibiotics. So I think the beauty of herbs is that not only are we effective at going after the organism and targeting it, whether it's Lyme, strep, mycoplasma, candida, but we get the other benefits of herbs. Many herbs are also anti-inflammatory. They help promote better circulation. They help boost your immune system. They modulate your immune system. So we get all these additional benefits with herbs. And if you're working with someone who's knowledgeable on herbal medicine, they can really help mix and match and find the right things for each person that becomes very individualized. That's really kind of specific to that person. But I mean, I've seen herbs work in places where antibiotics really just failed miserably, and we get a lot less side effects, and they're just much better tolerated.
Well, it's interesting you talk about the autism community with the mitochondria, because in this population of normal typic children that have the sensory processing issues and the various host of behavioral issues, I'd say at least 40% of them also have mitochondrial errors.
Yeah, that's been my experience as well.
Yeah, so I appreciate you touching on that, because I see a lot of people running to antibiotics as first-line treatments for chronic issues. And I get the ones that have been on 6 months of antibiotics and they're just going downhill, and I see them once they've completely crashed. So I really appreciate this wisdom that you're sharing, because I think people need to hear that, chronic antibiotic use is not necessarily the smartest way to go. And sometimes it creates more problems than it solves.
Absolutely. And I think, there's this myth in medicine, and again, it's just an education thing, that, people don't have the confidence in herbs because it's something they're not familiar with. And certainly if you're a conventionally trained, provider, that may not necessarily have been something you learned about in school. So this concept that antibiotics are stronger, that they're better. I think, again, a great example, Dr. Eva Shapi, she's a researcher at the University of New Haven. She got Lyme herself, and she decided to start, doing a lot of research on Lyme. And when she started looking at some of the herbs, her research is showing us that the herbs are more effective than the antibiotics.
Wow.
As good, they're actually better. And we know that Lyme is one of these organisms that's a true shapeshifter, and it changes shape. And when it changes shape, it can evade the immune system. Well, we know something like doxycycline really only treats Lyme when it's in one particular form. When it goes into the other forms, doxy just doesn't work. Well, what she showed in her research, now granted it's in vitro, is that the herbs were effective when it was in all forms. So, whatever that's worth, I think people need to understand that, herbs can be very powerful. Not to mention that, how many drugs do we derive from herbs, right? So, it's just a function of, again, working with someone who really understands, herbs, dosing, when they're not appropriate. We can't make a blanket statement all herbs are safe. They're not. But by and large, a lot of the herbs that we're using to treat, Lyme and pandas and these things are safe for children at the right doses. But you do need to work with someone who's knowledgeable on that and can help guide, how to dose it.
Yeah. And so let's just continue with this, because I wish every person could get access to you. How much of this information do you cover in your book and also in your upcoming course? So for someone, let's say they've got their local doc, that person is willing to work with them, can they basically use the information that you have as a template of figuring out which herbs to use and how to go about using them?
Yeah, so in my book, I specifically lay out the dosing schedule, and particularly for children. There's a whole section under the herbal chapter on how to dose it for children. So that's all laid out. So really anybody can do this on their own. You don't necessarily need to have a doctor overseeing this. You know, the herbs are safe. And again, the goal is always to start small and work your way up as, you know, kids tolerate. So that's all laid out. And then in the course that we'll be launching this summer, we'll walk people through, you know, herb by herb, what it does, why you use it, how you dose it. And again, I'll talk very specifically on how to dose it for children so that parents feel comfortable knowing that, you know, they're not giving their children too much. But again, you know, the nice thing about these herbs is that, you know, the is so astronomically high. The amount you would have to take is just, you would have to intentionally poison yourself. So,
Yeah.
you know, not dealing with certain herbs that, you know, tend to have a lot of alkaloids in it or things that can potentially be toxic. You know, these are all very well tolerated, and you know, we just don't really see toxicity at the doses that we're using. So
Yeah.
I feel pretty comfortable and safe in using it with children.
Well, you're preaching to the choir. You know, before I did my, you know, medical herbalism training, I was using supplements and, you know, pharmaceuticals. And once I learned about the plants, there's no going back. Once you realize what these plants can do and how effective they can be, it just completely changes your entire mindset.
Yeah, and you know, again, we've given one drop of one herb and they start to get a die-off reaction, whether we're treating yeast or treating Lyme. So how is it the one drop of one herb of a tincture can induce that kind of change? Well, it just speaks that, you know, it is potent and it is doing what you want it to do. So again, I've had this discussion with other, mostly medical doctors that, you know, really are convinced that antibiotics are a much better way to go. And look, at the end of the day, you've got to do what works best for your child. And if they're doing great on antibiotics and they're responding beautifully, wonderful, great. You know, make sure you protect the gut, but outside of that, fine. You know, my population are generally the people who haven't done well with antibiotics. They've tried that path, they didn't do well, they got worse, or they just had, you know, adverse reactions to it and they can't do it anymore. So, you know, I try and find things that, you know, are safe and gentle, but are going to be clinically effective. And I think, you know, herbs, when used appropriately, can really help a lot of kids, you know, get over Lyme or any of these persistent infections.
Yeah. Yeah, you see the train wrecks that haven't responded to the regular treatments.
Yeah. Well, and even, I mean, when you look at other kind of infections, whether it's ear infections, sinusitis, bronchitis, you know, again, herbs are beautiful at dealing with all this. I mean, I think I can proudly say I don't think I've ever written a prescription for an antibiotic for an ear infection, ever.
Good.
I've been in practice 20 years. I think we've got a lot of great remedies, you know, including herbs, that can effectively treat ear infections and, you know, having to stave off the antibiotics. So, you know, again, when you know the right herbs at the right time, it can really help, you know, improve the health of kids. Plus, again, we avoid all those potential side effects, you know, with antibiotics. And, you know, I remember there was a study several years ago. It was a rat study, so take that for what it's worth. But when they gave the rat a single dose of antibiotics, they wanted to see how long it would take for the rat gut to repopulate back to normal. And I was shocked at how long it took. And then again, it's a rat study, but one dose of antibiotics took 6 months to repopulate the gut.
Wow.
So I think as humans, you know, what happens when we're on antibiotics for weeks, months, years? In the case of Lyme disease, it's not uncommon that sometimes patients are on antibiotics for years. You know, what is that doing to the gut? And with all the research coming out on how important our microbiome is, it just makes me get really concerned that we're setting the stage for other types of problems down the line.
Yeah, absolutely. And, you know, hopefully within our generation, we'll see a shift, because at least now we have the information of how important the gut microbiome is and how silly it is to, without thought, use antibiotics in kind of a willy-nilly fashion. You touched on something that I'd love to expand on, if you're okay with it. You touched on how a drop or two of certain herbs can actually cause a die-off. And, you know, one of the things that I've read is for certain infections, like for instance, I believe Bartonella, it's really difficult to actually detect that on a blood test. What has been your experience in terms of detecting co-infection? So Lyme, we kind of talked about, we've got that great lab in New Jersey. We've got other labs we can use. But when it comes to some of these co-infections, is there a way to navigate the waters? So you've got Lyme, you kind of think about that. How do you break down other co-infections to think about? With Bartonella, do you use the herbals? Because I've seen some people suggest that maybe you give a drop or two of certain herbals, and if they react to it with a die-off, then you can say, aha, we've got this co-infection that we need to also think about.
Well, with regards to testing, again, I think, the labs that specialize in tick-borne disease are really good at testing for all the co-infections, including
Okay.
Bartonella. There are some of these co-infections that will see other signs and symptoms that might be a bit different than Lyme. One of the classic things we see with Bartonella is sometimes you'll see these little streaks, we call them striae, that look like stretch marks. And you'll see that often on the torso, on the back, on the sides, and sometimes on the belly. And when you see that on a child who hasn't, lost a lot of weight, big red flag. Again, I am not aware of, and you as a pediatrician may know better than I, but I am not aware of any other condition that causes those they're horizontal purple streaks that look like stretch marks in, skinny kids. And I've seen it several over the years, and that's a very classic Bartonella sign. So Bartonella tends to cause that. Bartonella can sometimes cause a neuropathy, which is like numbness and tingling. For people who have Babesia, because it's a cousin of malaria, we'll see almost, like malaria-like symptoms with cyclical fevers, but they'll keep spiking these fevers, every few days or something like that. And Babesia triggers this thing called air hunger, where you'll see sometimes these kids like gasping for air. They're not asthmatic. It's not that kind of process, but they just feel like they can't get a deep breath in. So sometimes we get a few of those little clinical clues that might suggest there's some other kind of co-infection. But a lot of these symptoms tend to be very vague, and they overlap a lot amongst one another. So that's why we test for everything. Because clinically, if someone comes in, their child says, well, they're tired and their joints hurt, and they're not doing well in school and their behavior's bad, clinically that could be anything. So, that's why we just have to go through that process and rule out all these other, infections. But, when we see those few little things that might be unique to other co-infections, that at least gives you a suggestion there might be something else going on. I remember there was a study that came out several years ago looking at least ticks in the Northeast, New England essentially, and they found that like 37% of the ticks that carried Lyme also carried something else. So depending on where you are in the world, if you do get bit by a tick that carries Lyme, there's at least a decent probability that it's Lyme plus something else. Interestingly, with the herbs, a lot of the herbs we use kind of cover everything. So they treat Bartonella, they treat Babesia, they treat Anaplasma, they treat Ehrlichia. So there's not as much variation, I think, in the herbal therapies as there would be with antibiotics. When you're using antibiotics, you definitely want to know what you're treating, because some antibiotics work better with one organism than another. But with herbal therapy, it's a little bit different. And I was at a lecture last year with Dr. Lee Cowden, and Dr. Cowden has a whole protocol that he utilizes. And he kept talking about keep herbs. And finally, after hearing this a few times, I asked him, I said, what do you mean keep herbs? He goes, well, it kills everything except people. Oh. So, these herbs have kind of broad antimicrobial effects. So they'll, go after bacteria and viruses and fungi and parasites. But interestingly, they don't disrupt the normal gut microbiome. And I don't really quite understand why that would be. It seems to me that if it has the capacity to kill bad stuff, why doesn't it kill off the good stuff? And I'm still very careful when I use herbs, particularly with kids, to make sure that we are still protecting the gut with probiotics. I still think there is some element of die-off, with using botanicals. But by and large, we don't see the same level of adverse reactions with herbs that we do with antibiotics. But I think it's something that you want to be mindful of when you're using herbal medicine.
Amazing. Yeah, I 100% agree. I wish I had something smart to say in response to that, other than yes. In some of the various types of phytotherapy that I use, plant herbals, it's the same thing. Just because it's a plant doesn't mean that it can't cause harm, and just because it's a plant doesn't mean it doesn't have potency.
Yeah, and you got to be careful for kids who are already on medication. If you've got a kid who's on seizure medication, if they're on, asthma medication, there are some herbs that directly are contraindicated with those medicines. So, if you're going to use herbs, make sure, again, that you're at least looking up any kind of potential contraindication, because fortunately it's uncommon, but I have seen a handful of cases over the years that kids just had very bad interactions between their medicines and herbs that the parents were trying to use to help improve their child's health. So again, it's not common, but it does happen. And there's actually quite a few good resources out there that talk about drug-herb interactions that, people can buy. But again, if you're working with a practitioner who's knowledgeable in herbs, then they'll probably know what those interactions are.
Great. And speaking of that, so I mean, I wish every person could just get access to you and just tap your brain, but realistically, depending on where people are around the world and the country, that may not be able to happen for them. Is there a resource that you can share with us where there's other naturopathic doctors or other physicians that are trained in medical herbalism, especially with these chronic infections and so forth, that we can share with our community, or is there a website that people can go to?
Well, part of naturopathic medicine, part of our medical training is botanical medicine. It's a big part of our training. So anyone who's a licensed naturopathic doctor in the United States will have completed at least 2+ years of botanical medicine training. So the website is called naturopathic.org, and that's the American Association of Naturopathic Physicians, and that has a list of NDs around the country who are licensed and have been trained appropriately. So that's a great resource for people. And I find even now a lot of functional medicine doctors are getting extra herbal training. So, places like IFM, the Institute for Functional Medicine, is another good resource where you might find someone who understands herbs.
Beautiful. Beautiful. Thank you. Is there anything else that you think our audience should know about, the incredible work you're doing, the chronic infections? I mean, there's so much that people need to be aware of. Anything else that you think they should know about?
Well, I think my take-home message for parents is that, again, if your child has been having these sudden, abrupt changes in the way they are in the world, again, whether it's mood, behavior, language, cognition, there's got to be something that's triggering that. It doesn't just spontaneously happen for no reason. Dr. Doris Rapp, R-A-P-P, she was a pediatric allergist and one of the most brilliant doctors I've ever had the opportunity to study with. And she wrote a great book called Is This Your Child? And she used to do handwriting samples on kids sort of before and after they were exposed to different things that would affect their brain. And you could see handwriting change. You could see they would draw pictures, and first they would draw a happy picture, and then after being provoked with something she thought was bothering them, they would draw a very ugly, nasty picture. And as soon as she kind of turned it off, they would go back to being, happy again. So I think it was a great demonstration just, how quickly and how much these different external influences can impact your child's brain and really their overall health. So, when you start to see these sudden changes, I think it's just that should be a red flag for you as a parent to, see your pediatrician, your healthcare provider, start getting them evaluated for whatever those triggers are. And sometimes it's allergy, sometimes it's infection, but there's got to be some explanation of why you're seeing that change, because it's not really inherent in children's nature to behave that way. So I think, the sooner you can figure out what the cause is, then you can really make sure you're getting the right treatment for them.
Amen. Thank you. And, that's, I think, the whole reason why I created Holistic Minds, because I can't even imagine how many hundreds of thousands, perhaps millions of families are out there where their kids are just acting in this irrational, weird fashion. And the parents know that there's something going on with the children. They know that this is not their child, but they have nowhere to turn to. They have no way of accessing the information to ultimately understand what is causing their child to go haywire. And these kids are put on antipsychotic medications, they're putting on Ritalin, they're put on all of these different things. They're labeled as the bad child. And children don't want to be bad. I mean, outside of social factors, within whatever else, which is another discussion, most children inherently do not want to be bad. And when someone is going haywire, I think we owe it to that child to really take a good look and ask what is going on that's causing this child to fall apart.
Yeah. Well, when I see that compilation of sort of the neuropsychiatric symptoms, and when we do see a lot of those other physical symptoms, I mean, for kids who start experiencing joint pain, that's rare. I mean, you don't get arthritis, when you're 8. So when we start seeing, these various, arthritic complaints or musculoskeletal problems, coordination problems, again, that are really sudden onset, and we see those neuropsychiatric symptoms, boy, that just screams that there's really some sort of underlying infection that's triggering that. And, again, the sooner you can figure out what it is, the sooner you can start treatment and get them, getting healthy again.
Yes. Amen. Thank you. I really appreciate this, and I appreciate your time and taking the opportunity to share all of this wisdom with our families because they
Yeah.
need to hear this.
Oh, it's my pleasure. Thank you so much for having me.
Yeah. Have a great day.
All right. Thanks, Dutchman.
Bye.
Bye.